You know, I get a lot of questions about how much does an implant cost, and honestly, all the marketing out there about what the costs are, and I sit down with some of my colleagues and I see kind of what the marketing is around that. It can be misleading, and so I want to be transparent, and let me just share with you what some of these things are. The implant cost itself, we pay the same. Well, that's not true. We probably pay less than most of the surgeons out there because we do probably more in a week than they do in a year. So volume, we get a little bit better by. But the cost of an implant can be $295 to, in a specialized situation for an implant, it may be $1,400. So when they're quoting you $1,000 for this little silver titanium piece that goes in the bone, they're just giving you the cost of what that component is. They're not telling you what it costs to actually have it placed, or all your x-rays or exams or anesthesia or all these other things that they add on. So it's not real transparent. And so when we talk about the cost, it's a little, you're not real sure in terms of what's included in that. Another thing is how many doctors are involved in the implant process. Is there a surgeon and a different prosthodontist and a different radiologist and all these components? Or for us, we do that, I do all of that. I'm doing the surgery, we're doing the prosthetics, we're actually designing and doing the lab part, so we have control of everything in-house. So by controlling that, our cost, it will lessen the cost for our patients. How much surgery is needed? How many surgeries? Do we have all this extra grafting we have to do and all these extra procedures? Or can they be limited? Can we use the bone that's available and maybe save some money and do some things less? So that's part of what adds to the cost. Big lab bill. This is an enormous part of what this percentage of expense is for the dentist doing this. And while outsourcing that is an option for people that maybe have less experience or don't do this as much, for our practice, we do all of that in-house start to finish, so we can control that expense. Insurance coverage. I get the game about, oh yeah, let's check your insurance. Insurances in general, you're going to have about $1,000 to $2,000 max a year, and you're going to get that maximized in these type of treatments. So again, it can be misleading how that's presented, but that's something that goes into the cost. Another thing that affects cost is what they're making the teeth out of. You can do old school where we do acrylic denture teeth and a bar that kind of connects everything, or you can use zirconia, which is super strong, beautiful, and last long time, much better than what we've had before. But again, if you pick the cheaper material, it can affect the cost, and so those are things that we have to consider. Warranties and maintenance, are these things covered? How long are they covered? Are you going in, are you doing your hygiene, are you doing your recare system the way that you're supposed to? Is that included in what we're doing, or is that extra? How long are the warranties? For us, if it's within 5 years, we're managing that when it comes to anything that breaks on the teeth, the screws, anything like that. The implants themselves are covered for 5 years. If there's all those things failing, that's a very high risk on our part, and if we weren't doing things right, we wouldn't be able to give you that. So that's part of it. Snap in, snap out teeth, those are things that can be marketed as we give you teeth in a day and we can use implants to replace your smile. If it's just a denture and they snap onto implants, that's totally different than where we put implants in, where teeth are connected to those like natural teeth where you can chew and eat what you want to. And of course, last but not least, I have a personal bias, but I think if you're going to have a procedure like this done, you should look for someone who is a specialist, board certified by the American Board of Oral Implantologists. And if they have gone through and they have that board certification, that level of expertise is different than someone that's just marketing a cost of a dental implant. So that's why, looking at all of these things, you can imagine I've got to see these patients. I want to give them an accurate treatment plan that gives them the actual cost. I don't want to guess on this. There's no way with all of these things involved I can give something over the phone that makes sense. That's just not a transparent way to do that. And if you'll give us a chance to come in, it's a free consultation. We're going to do a free cone beam CT, which is a 3D radiographic rendering of exactly how your jaws are, and I can look at that and we can sit down together and go, what are your dreams? What are your goals? What do you want to accomplish? And together we'll develop a treatment plan. And at the end of that, we'll give you the exact cost. But that's why we I'm not a big advocate of trying to say over the phone, yeah, this is how much it costs. It's just not, it's not a way that you can do that accurately. And we set people up on payment plans. So when we're worried about cost, is it something that's affordable that you can do, or is it something that they're just giving you the outright cost? So for us, give us a chance, call our office, come by. We want to be able to help you go through this process, so at the end of it, you get the best results that you can. You can function again, you can get out there again and be all the things that you want for yourself.